You mean when the patient can return back to his work or can travel after rhinoplasty?
Yes.
Okay, fine. So, very important point I like to mention that we do all our procedures since 1999 for last 24 years under local with deep sedation. So we very rarely use general anesthesia, and we very well prepare the patient before surgery. Most surgeons, they give the patient GA and they go ahead and start the surgery straight away after the induction of general anesthesia. We do not do that. We start first with welcoming the patient, and then patient taken to the operating room and given sedation. This will make the patient very sleepy. And then I start to inject my local anesthesia drugs in the nose. And this local anesthesia drugs also contains a vasoconstrictor agent. And this will help very well. After we inject the local and the vasoconstrictor, I usually wait between 12 to 15 minutes. That will give very nice, adequate time for the nose to become very numb and also to get adequate vasoconstriction. The importance about the vasoconstriction is that it will give me very nice, dry field during surgery, and this will reflect on the surgery itself. So when I have a nice dry field, I'll be able to see the structure better. I'll be able to operate more, very accurate. Because there's bleeding and the blood, surgeon may take more or take less cartilage or bone. So it's very important that we have a very nice dry field in order to be able to operate and do the steps of surgery in very nice, accurate manner. And again, this reflects after surgery with very less bleeding. Less bleeding during surgery, almost very dry field, and after surgery, almost no bleeding. And almost there is very little edema or even no edema or no swelling. If you look at my YouTube channel, there's so many patients. We have over 900 operative video patients, the largest rhinoplasty video library in the world. Over 900 full surgery. And we have so many videos on social media. You see patients after 5 days, after 7 days, 10 days after surgery with almost no edema and no swelling around the eye at all. That's because of our good technique of local anesthesia with deep sedation, and also the good preparation of the patient and giving enough time before surgery, before we start surgery, to prepare the nose and inject local and vasoconstrictor agent. So always, nice, organized, well preparation of the patient, end with good results. And when the patient returns back to work, if the patient works online, for example, online people who do most of their work online, they can actually start working 24 hours after surgery. Next day, next morning, they can start doing all their online work. Patient want to meet the media, meet people. His job, meeting people or going back to the office or whatever, then he actually can go back to the office after 2 days, no problem. But if you want to meet people, meet the media, meet people, then if we have done only the tip and the nostril, usually after 1 week. If we have done full rhinoplasty, the hump, the bone, and the tip, usually I will say 10 to 12 days. Then he can go back to work and meet people. About traveling, patient we have, most of our patients actually come from abroad. We have, on daily or weekly basis, patients coming from all the Gulf countries, Saudi Arabia, Qatar, Kuwait, Bahrain, Oman. We have on weekly basis patients coming from United Kingdom. We do Zoom consultation. Patients on weekly basis coming from all over the world, all over from North Europe, from all countries, from France, from Sweden, from Holland, from Germany, from America, from Canada, from Australia. Even have patients come from Australia. So because we do Zoom consultation, but this patient can actually travel next day if they want. After 24 hours, He can stick the bill and get it. About follow-up, asking about follow-up, what happened, because almost on every time we have colleagues. I have friends, so I can usually give the patient a report. If he needs to travel, I give the patient a report and refer him to a colleague in his town with his name, his phone number, so the patient can, when he's arrived to his town, he call the surgeon and he can do the follow-up there. And also the patient can keep following up with us on Zoom consultation.